Hi, once again, this is Elena Coucher. I am presenting Module 2 of your Preceptor Development Program. Here are your Module 2 outcomes. Again, I will not read through these, but these are listed in the handouts that were provided to you in your Preceptor notebook. So in order for us to identify qualities necessary for a preceptor to be effective, a good one, the nurse preceptor, we have to understand what negative qualities prevent a new graduate nurse from learning. Some of these are: the preceptor does not set clear goals of orientation. The preceptor does not state those goals in writing. The preceptor does not make those goals measurable or achievable. Preceptor does not review the goals for the day or for the orientation process with the preceptee. The preceptor practices poor communication or is inconsistent with their communication style. Additionally, the preceptor does not assess the skills of the preceptee. You want to look at weaknesses and strengths. Preceptor does not introduce the preceptee to any other team members. And maybe if the preceptor does introduce them, it may just be a select circle. Everybody needs to meet. Everybody needs to become a team. Preceptor does not provide the new graduate nurse with an orientation to the hospital or unit. Preceptor does not allow the preceptee the time necessary to practice skills and instead takes over. I know this is a little difficult for all of us, and it's one of those things. You've been in nursing for a while, you know that you can get a skill done, and you know that you can get a skill done quickly, and you know that you can do it proficiently as well. So when you have a new graduate nurse who has taken their time to perform a certain skill because they're unsure of themselves, I think we think, I know that I do, and I've accused myself of this before, thinking that I'm helping when in reality I'm hindering their learning experience. Additionally, if the preceptor does not assist in building the preceptee, uh, their skill levels, and if they don't practice correctly, so the preceptor takes shortcuts and compromises patient safety, these all lend to being an ineffective preceptor. What about a preceptor who pressures the preceptee or the new graduate nurse to perform at your own level? Does that not compromise patient safety? Absolutely, it does. So we don't need to pressure them to perform at the level that we're performing at. These are new nurses, and they're babes, and we have to. You wouldn't expect to have a newborn that you would feed meat to. So you kind of have to take your time. Preceptor is rude to the preceptee or other staff members, families, or patients. I recall my preceptor whenever I graduated nursing school. There's many things that I can remember. And one of those things was, and I started out in CVICU. So we had a patient who had, you know, triple bypass. We're taken care of. And back in those days when I first graduated, I think we kept them on the vent for like 24 hours, it seems like. So this patient was kind of coming out from sedation a little bit, and I reached up to the ET tube to take it out, and she went in there and she caught herself because she caught me watching her, but she yelled at him no, and she raised her hand to pop his hand like he was a small child who was getting ready to touch a hot stove. So this is what I'm talking about, rudeness. If a preceptor is continually rude to other staff members, they don't respond appropriately, they don't respond appropriately to families and patients, it's not modeling the right behavior, and you become an ineffective preceptor. Preceptor does not actively engage the preceptee in patient care or the learning of new skills. When I say actively engage the preceptee uh, in patient care, I'm not talking you need to send your preceptee in there to give the patient a bath. They're there to learn the role of the nurse, and yes, we do have to do baths. I'm not saying that's not something that we don't need to do, but we have to be careful that we're not delegating a task out to a new graduate nurse and defeating them by not going in there and working with them as a team. Preceptor does not meet with the preceptee or administration to report on their progress or lack of progress because of, if you don't do that, it's probably because you haven't been essentially charting on your preceptee. Preceptor allows the preceptee or new graduate nurse to be utilized as regular staff prior to preceptorship completion and or terminates that preceptorship before the preceptee is ready. So I want you to think about it. What makes a great preceptor? Um, think about the ineffective one. The qualities that make an effective one are just the opposite. Do you feel like you're a good clinical nurse? Does being a good clinician make one a good teacher? You'll notice on the next slides, it does not take much to be a great preceptor. In fact, it takes more to be an ineffective one than to be a good one. And I want you to think of something else. Precepting is a memorable event. I just told y'all a memory from when I was precepted. So you remember your preceptorship. You remember the good and you remember the bad. So if you're not appropriately leading the preceptee uh, through your role modeling and being an effective preceptor, then it's going to influence how that new graduate feels about the profession. And ultimately, this can affect the quality of care to the patient. Now, clinical nurses are wonderful. You exhibit great clinical thinking skills for the patient. You are a leader and you are strong. Teaching is a whole new ballpark to play ball in. And we as nurses must hone our teaching skills to improve our confidence levels, increase satisfaction, and we want to be satisfied with our roles as preceptors. If not, we're going to be burned out and we're going to want to leave them fast. It also increases new graduate nurse retention, and ultimately, with the safety of the patient comes into play if we're not leading them through the preceptorship in the correct way. So, great preceptor qualities. The goals are measurable and in writing. Preceptor provides learning and practice outcomes. You integrate the preceptee in the unit culture, orienting them to the hospital unit and introducing them to all team members. You identify the location of hospital or unit policies, procedures for that preceptee. Direct them to areas in net learning or not net learning, I'm sorry, on employee net. Preceptors never leave the preceptee or new graduate alone in situations. We don't need to do that. Preceptor protects that preceptee or new graduate nurse by not allowing them to work above their scope of practice. You also provide constructive feedback. You do not belittle, and you don't become argumentative or unsupportive to them. The preceptor is also able to identify areas of concern and be able to intervene to provide additional help and teaching. Some additional things, the preceptor is an objective assessor of the preceptee's skills. Great preceptors will also seek out learning opportunities for their new graduate nurse to provide them with a well-rounded education. It's also very important to complete all the necessary paperwork that's part of the preceptorship. I've already talked to you about the orientation manual, but it is vitally important that we get that filled out and we properly proceed through there so that we have documentation and record of everything that we have done with our preceptee and that we have led them through. We need to know, and administration needs to know that they can competently take care of the patient. It's just also documentation, a very important communication tool. If the preceptee orients with another staff member or for communicating the success or unsuccessfulness of the task that they've completed. So how can I mentor effectively? I told y'all what a mentor was. I talked to y'all about what a preceptor was and what a coach was and how they kind of all intertwine together. Um, Mentoring is very important. You're precepting, you're teaching, but you're mentoring these new graduate nurses throughout the first year of their life as a nurse. So do you think it's important? Can you define what a mentor is? Of course you can, because we've already done that. To mentor another person though is a form of fostering that human development. You're investing time, you're investing energy, you're investing passion, and mentors above all a role model. And this is what you want to do. You want to intertwine that mentor and preceptor role together because you want this to continue. You want to be there for this new graduate nurse for that first year, and you want to be able to lead them, and you want to do so with your attitudes and your actions and the things that you bring to the table to teach them. Mentors are also very respected. They're valued by not only the preceptee, but all of their team members. So, shouldn't the preceptor role also identify as the mentor? Absolutely. As I've said, you want them to kind of meld together. Mentors may exhibit enthusiasm with all team members. They also desire to be the nurturer for the preceptee or new graduate nurse. You also think outside the box. Embrace change because it's a valuable asset to patient care. Mentors are not just there to get a paycheck. Instead, they practice the calling of nursing. Also, they ensure that they share their knowledge with others, and the mentors actually very acutely aware of, that they do not know all the answers. In fact, they view every day in the clinical setting as a learning opportunity. I tell my students every day that, or every time that we're rotating through the clinical setting, and I'll tell them, I'm going to be the first to tell you I don't know all the answers, but I'm willing to go and find them if I don't know them about what's going on with your patient. So these are just a small list of qualities that mentors have. On the next slide, I've chosen some attributes which fit nicely into the preceptor mentor role. If you want to impact nursing students and preceptees, new graduate nurses, then we need to learn to start treating them as professionals and teammates, valuable team members who impact patient care in a very positive manner. So effective mentors, and I'm going to use mentors and preceptors interchangeably, just so you know. You're an active listener. You allow time for thoughts and feelings. You're consistent. This ensures all other working with the preceptee will know what is expected. Um, you be a learner. Have a passion for learning and model that behavior. Challenge the preceptee to question and go beyond the expected. Also provide valuable feedback. If I do something wrong, I want to know that I've done it wrong, but I want it to be given to me constructively so that I know how to correct it for the next time. Stay current in your continuing education activities. Be an active team member in a preceptorship program and continually assess for quality improvement. Don't be judgmental because we were all students, new graduate nurses, preceptees once as well. But do encourage questions. There are no stupid questions. It may feel like it's coming across as a stupid question, but it's not a stupid question because if they wouldn't be asking it if they did not if they had already actually knew it. So be a leader for not only the preceptee but for other team members as well. Lead and guide by example. The phases of the preceptor relationship. There's two primary phases that all preceptor-preceptee relationships must move through. There's the establishment phase of trust, and there's the working phase, implementation of the education plan. Trust, oh my Lord, you can't go anywhere without trust. A relationship is not going to move if there is not any trust there. It's an important component of any relationship, trust is. Without trust, the relationship is going to falter and it is going to fall apart. Do you remember walking onto the unit for your first day of orientation? How nervous were you? Did you sleep the night before or did anxiety keep you awake? I know I didn't sleep. Um, Again, review your orientation manual and set a week one plan and communicate this plan. Preceptors can assess the new graduate nurse's or the preceptee's nursing skills before he or she arrives. You can you can start that communication process. I've already said in the previous module, send them a text message. You know, most of today's people, the this generation that we have coming into nursing now, texting is one of the biggest things that you can how you can communicate with them. So text them. Let them know I have a plan set for us to begin your orientation this first week, get through the first week, and then have them start assessing what do they want to do, what goals do they want to achieve, and you both get involved in the plan. But before he or she arrives, you've got to build that trust for them. Thoroughly outline the plan for orientation and use that orientation manual. Encourage your orientee to be open and honest with you. In return, you're going to provide them with a non-judgmental ear to hear them. I had someone share with me her first encounter with her preceptor. It began before she even arrived for her first day on the unit. She said her preceptor sent her a card to her, sent a card to her stating who she was, um, that she was excited to meet her and begin the orientation and learning process. So she said that she still has this card to this day. She said, I kept that card, and I've been a nurse for 25 years. I still have that card today. You're going to send a text message. You're probably not going to keep the text message. However, you've opened that doorway to start building a trust. You've sent them a picture. They know who you are. They know what you look like. They know your name. They know that you have a plan for them. They know that you're excited to lead them through the learning process. And this starts that first foothold of trust. Provide your preceptee with that questionnaire. We've already talked about that. If they have that orientation manual already, when you send that text message, you have them. You point to those pages that you want them to fill out before they even come in there. If you want to have a hold of it before they come in, tell them that you would, if they could just fill it out and take it out and bring it up to the unit on a day that you're working, or even send it to you in the mail. That way you have an idea of what skill sets that they know, what they might have done and what they haven't done. When you establish that orientation plan for them, ensure that you communicate it with the preceptee. Um, it's just a formal way of I say formal. For it is formal. It is a formal way of being totally involved and immersed into the orientation process. And it gives you some validation along the way if your preceptee is struggling. And you can say to communicate to administration and communicate to them that your preceptee is struggling so much. You've had all of this documentation for that. Because you're building this trust relationship, you may want to get a little bit more in depth about your preceptee. Ask them what school did they graduate from? Where are they from originally? Ask them about their family, and then proceed into some other areas. Check their work experience out. We have so many business-minded people who are stepping into the clinical setting to become uh, nurses now. So you might be encountering a new graduate nurse who has never had any health-related experience. So these are just some things that I think of that you could do to get involved and know about your preceptee and start to build again on that trust relationship. One thing you can do is ask them before they come in. Send them on that text message. You know, is there any particular questions that they have for you before they arrive on their first clinical day? Because a lot of times they have questions, but they're scared to ask them. So open the door for them to ask those questions. The working it phase. All right, so during the working it phase, remember that questionnaire from the slide before, or asking those questions in the questionnaire in your orientation manual? It's also another tool that the preceptor can use to help map out the working it phase for the preceptee. Use the orientation manual provided. There are some specific requirements the preceptee must meet. Provide that preceptee with a brief orientation to the manual. And in order to provide them with that brief orientation, you have to orient yourself to it as well. You have to know what is expected. I would even highly suggest you take little tabs and put on in that manual so you know what is week 1, what is week 2, 3, 4, what is it the preceptee needs to be doing, what is it that you need to be doing. Highlight, mark things. Um, Provide them with the preceptee with a brief, again, orientation to the manual. It's also, you need to consider it a link. It's the link between you, the preceptee, and administration. We need that link. If progress is not being made, you got to provide documentation to validate this. So in the working it phase, you the preceptor have set a plan. Now what about implementation? We're gonna get that started. In order to get an implementation started, you have to put into action everything that you planned for thus far. So put into action your very own actions of the role model and mentor. When role modeling, ensure that you maintain professionalism in nursing skills using evidence-based practice, problem solving, and critical thinking skills. During the working it phase, you want your preceptee to observe others' interactions with patients and family members as well. You don't want to be the only role model. Pick and choose. If you know somebody who responds very well, maybe there's a situation where the patient is dying, and on behalf we have this happen often, and there's always somebody who's able to handle the death and dying process better than others. There's always that one person who's able to really minister to the family better than some others. So if that's the case, then you want your preceptee in there watching this. You want them to see that interaction that occurs so that they can learn from it. Remember that the plan that you created for the preceptee. I want you to provide feedback constructively for continuation of goal attainment. This is very important. And I know that I talk about this quite a bit, but that is it's one of the biggest things that, and I'm willing to provide anyone with the books that I utilized for this. But in every one of the books and every one of the evidence-based practice journal articles I read, communication and being able to write those goals and having that link between you and the preceptee and the administration is absolutely essential. The end goal is that your preceptee is going to transition from dependent to independent practitioner. And as they transition, it's going to be through your guidance. So make sure that patient safety is a utmost concern. Before the first day. As I stated earlier, the trust phase of the relationship begins before the preceptee arrives. So send that handwritten note, send that text message, reinforce that the time that they should arrive. I will meet you at the round table at 6:20 in the morning. Please arrive on time. Do not come in at 6:40, and that's just one of those times that you maybe you didn't set your clothes out the night before. Maybe you had a lot of things that came up. Whatever the case, try to meet and get everything taken care of before you go to bed. Get your clothes laid out. Do whatever needs to be done, because this is the first day that you're going to be with this preceptee, and you don't want to arrive late because you need to role model good behavior in the first place. Plus, it leaves them feeling really uncomfortable. My preceptor's not here yet, and I'm just standing here waiting for them. Ask the preceptor if they'd like to visit the hospital prior to the first day for a thorough tour. That might be something that you can do, and mark that off of your list before they even get there. Make sure that they have a locker. You might even want to place a welcome sign on it for their arrival. These are just some things that I can think of that kind of help to build that trust phase, that it makes a preceptee a little bit more comfortable before they actually come to the unit. Here's another thing I can think of before if you're going to be absent, if you have maybe you have the flu, because come on, life happens. We know that it happens. So you get the flu. You want to make sure that you communicate with your preceptor along the way, or the preceptee along the way. Let them know, I will not be at work today. I have the flu, but I made sure that you'll be working with, and you outline who that you feel like the preceptee could be working with, and try to get that taken care of for them if at all possible. Again, you're building trust and you're making them comfortable. The primary task for the day is alleviating the anxiety the preceptee is likely experiencing. If for some reason the preceptee did not receive and fill out the questionnaire, allow them some time when they get there, 10 or 15 minutes. Let's take some time and you fill this out. And here's where you want to outline week one plan. You also want to welcome questions. Have them, even if they're at home at night, when you go home tonight, if you start thinking about questions that you want to ask me for tomorrow, plug them into your phone, write them down in your orientation manual, do anything so that you can ask me tomorrow and I can help you with this. Ensure the preceptee has their Epic login information and that they have Pyxis access. You want to make sure that they are familiarized with all the safety equipment. Take them around. Where's the crash cart? Where are the fire exits? Um, where are the safety data sheets? I encourage full participation in active learning experiences. It's a good idea to discuss the role of the nurse in case of emergencies such as fire. I, I'll tell you, I don't remember this being discussed with me by my preceptor whenever I started nursing 15 years ago. I had no idea that what are we going to do if there's a fire? How are we going to get these patients to safety? What's the plan? And so these are some things that you don't think about, but these are things that preceptees, they're new to the floor. You come to work every day and you do your job, and it's an expectation that there's not going to be anything crazy like fire going on. But a preceptee may think about these things, so take the time to explain it to them. Um, that the first day you probably anticipate that it's going to be primarily observation, but you do want them as deeply involved as possible. What about honing those organizational skills? Have you ever heard the saying, every cook has a different kitchen? Aid the preceptor in organizing the day. Maybe the preceptor could encourage use of a clipboard, discourage use of multiple pieces of paper. Walking report, ensure the preceptor is making notes. Reviewing the patient chart, orient to that work list, tell them about break times. Medications, review the list. When I began practicing, I had an LPN who did things a different way that when I did. And she's the one who told me every cook had a different kitchen. Because I said, Sheila, I don't understand. You do things this way and so does things this way. And I just went through and she said, hey, every cook has a different kitchen. And over the years I've kind of taken that a step further. Yes, every cook does have a different kitchen. Somebody's going to make homemade spaghetti. Somebody's going to make store-bought spaghetti. Somebody's going to make homemade pasta. It really doesn't matter how the spaghetti is made as long as the end product is a happy group of people who have enjoyed eating it. That's all that matters. Medication administration, guys, I know that it's kind of like second nature to us. It's a good time for the preceptor to assess the knowledge that the preceptee has of medications. Do not tell them what to do. Um, I want you to ask them, what is the rationale for giving this medication? Why are we doing this? If you're unsure yourself, you need to look it up. If you know why, if it's a new med, you've never given it before, then you both need to figure out what it is. But you want them thinking about it. You want them having critical thinking skills through the process, and you want to know why. You ask them all those pertinent questions. What are the side effects? What are we going to look for? We have reports, so now what? I'm certain that some of you as preceptors have your own rhythm that you follow, and that's perfectly fine. I did go buy books for this. However, remember to slow down to start your preceptee out on a step-by-step plan for the day. After report, lead them into prioritizing their patients. I had a nursing school instructor who told his students before, look at your patient. What do you see? What do you feel? What do you hear? It's another form of critical thinking. That's what she would drill into us. So do the same thing. We're going in to assess our patient. What did you see? What did you feel? What did you encounter? What do you think is going on with this patient? Um, so and as a med surg nurse, many nights I would come in to fresh surgery patients who had extreme pain. No, no one could get a handle on, and I'd trace those lines because I remember those words. Look at your patient, and so she would tell us to trace those lines, and I would. And half the time I found their epidural infusions on the floor. The floor must have been highly, highly numb from having all of that. So make notes on what you see or hear, and then question the preceptee as to what they saw and heard. It's really important because it aids them in critical thinking. And then document one patient at a time. Precepting needs to relate the documentation to one at a time to ensure that they have clarity in their documentation. How do I teach critical thinking? Teaching critical thinking is a difficult task. Preceptors need to move past bad habits of directing and doing task oriented tasks and move towards good habits of questioning, leading, and guiding. A basic internet search will give you an array of definitions for what critical thinking is, but for the practitioner, critical thinking community defines it as when it's developed in the practitioner, it includes adherence to intellectual standards, proficiency in using reasoning, a commitment to development and maintaining intellectual traits of the mind and habits of thought, and the component of using thinking skills and abilities for sound clinical judgments and safe decision making. You want to ask open-ended questions to them throughout the time that they're taking care of a patient. Tell me about your patient. What are the next steps you're going to perform for this patient? Tell me the rationale as to why you're completing it in this way. Don't tell them what to do. Lead them through it. And then, did the interventions you performed for the patient affect them positively or negatively? You want to know that. The first item on the critical thinking list is a preceptor must instruct the preceptee on identifying problems with the patient. The next thing is guiding them into intervening. Um, assess the preceptee, asking the preceptee questions helps them evaluate the patient problems. And after moving through that nursing process for critical thinking, if your preceptee is unable to answer the questions, the preceptor should begin again with basic questions and build up to the more complex. It's vital that we do so. Habits of effective critical thinkers, they have confidence, they have good reasoning abilities, they have contextual perspective, they look at the whole picture, they have creativity, they think outside of the norm, flexibility, inquisitiveness, intellectual integrity, intuition, open-minded, they have perseverance because they're determined, and they have good reflection, so they're able to self-evaluate well. The bad. For every good habit, there's always a bad. This slide identifies ways that a preceptor can limit the preceptee in their critical thinking skills. In addition, the nonverbal cues can hinder the preceptee. So if you're doing eye rolling or you're acting frustrated or irritated, sighing, you're tapping your fingers. My first preceptor on a critical care unit belittled me, treated me as if I were the dumbest person she had ever met. For example, hanging blood for the first time on a patient who had a thoracoabdominal aortic aneurysm repair. She huffed as I asked questions, literally huffed. You need to remember your preceptee does not hang blood as a student. So when I questioned her, am I asking too many questions? She stated that some things just take plain old common sense. And she said it to me just like that as she bopped her head back and forth. So be aware that your preceptee does not have common sense for the clinical setting yet. So this is what you're wanting to build in them. You're wanting to have that. The 5-minute preceptor. The steps for it: get the preceptee to take a stand, probe for supporting evidence, teach general rules. I've already really kind of discussed this, and there's different ways to be a 5-minute preceptor through clinical or critical thinking. You can use the nursing process on it, or you can use this 5-minute preceptor tool. You want to teach general rules, you want to reinforce the positives, and you want to correct errors and misrepresentations. So step one, you get them to take a stand. During this phase, you will make general, non-specific statements or questions about patient care or situation. So tell me what is going on with your patient. So this is where you get the preceptee to tell you everything that's happening with them. This allows the preceptee to process the clinical information to communicate it to you. You want this information to be the preceptee's interpretation of the current clinical status. When you probe for the supporting evidence, you're actively listening to what their response is. You ask questions that extract information and rationale. This tactic encourages the preceptee to think. You utilize the probing questions that will also provide you, the preceptor, with an assessment of the learning needs which need to be evaluated. So tell me why you feel that you should call the doctor at this time about Mrs. K. Well, I don't know. I just feel like since we placed the NG tube last night because of vomiting, there should be drainage. There isn't any. So maybe the NG tube is not functioning. And then you teach general rules. Share your knowledge at this point. Do not make more than 3 points with them. And then you use evidence based and policies to drive home your points. So for any patient with an NG tube, you should assess the function of the tube and the presence of suction material at the beginning of your shift and throughout. In report, you need to question the amount of drainage noted and the description from the shift before. You should also check for bowel sounds in the presence of nausea and abdominal distension, which could indicate that there are stomach contents that are not being removed by suction. And then you can go in and start talking about if it's a Salem sump, you can talk about that. You will tell them what they're going to hear when they're assessing it. When you've done, and then you lead them through. When you've done all your assessments and found the tube is not working, then you should call the physician. You don't want them calling the physician before they've actually done everything. And I know that you guys know this, and I'm going to provide y'all with this in your clinical notebook for critical thinking and leading your new graduate nurse through these critical thinking steps. So you want to reinforce the positive at this point. Provide positive feedback. It was good that you noticed that the section was not working. Give the rationale or explanations, and then identify the preceptive strengths and weaknesses. So as you're being the 5-minute preceptor and leading them through critical thinking exercises, by step 5, you're going to correct any errors or misinterpretations that they might have had. You want to give feedback that is constructive. You want to provide them if it happened to be over a pump, whatever the situation is, and they wanted to call the doctor, and you led them through, and you encourage them to assess and use the nursing process and to critically think about their patient and the next steps. Then you can help your preceptor to improve their understanding by providing them with some educational materials or even encouraging them to go and find out the policy and procedure for a certain thing. So putting it all together, review the preceptor-preceptee handbook. Tab all the pages which pertain to your task and the preceptee's task. Document, 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 and Work through the weeks to ensure that you are preparing the preceptee to be a safe practicing RN. This is the end of Module 2. You will have a 9-question competency exam that you will be required to complete and pass at a 90%.